Exploring the design of patient-generated data visualizations. Collecting patient-generated data is becoming increasingly common in chronic disease management. Patients use various technological tracking tools to collect their health and lifestyle data, hoping to understand their health better or to share their data with healthcare providers, expecting to receive more tailored medical advice. When patients collect their health data over weeks or months, it often turns into a large and complex pile of data that is challenging for healthcare providers to make sense of them in short clinical visits. On top of that, most of the existing tracking tools are not designed to fully meet patients' and healthcare providers' expectations when reviewing patient-generated data during clinical visits. The objective of our study was to design visualizations to support patients with chronic condition to present and review their self-collected health data with healthcare providers during clinical visits. We took an iterative design approach with involvement of patients and healthcare providers. First, we conducted a focus group with providers to get their perspective when reviewing patient-generated data. Then we interviewed 8 patients who actively collect health data and design potential visualizations representing their data. Lastly, we interviewed healthcare providers seeking their reflection on our proposed visualization designs. To clarify, confirm, and gain a deeper understanding of healthcare providers' perspectives about the patient-generated data collection review process, we conducted a formal focus group with a mixed group of healthcare providers. Our focus group included a clinical endocrinologist, an internal medicine specialist, a health counselor and researcher, and 3 other health researchers who were present during the focus group listening to the discussions. From the results of our focus group analysis, we extracted 4 requirements mentioned by our healthcare provider participants to support reviewing patient-generated data during clinical visits. Healthcare providers needed tools that are able to integrate context with patient data. They wanted tools with abilities to summarize and filter patient data to see trends, patterns, and anomalies. Providers wanted tools with ability to overview and focus on parts of the data to explore patient data in both focused and detailed views, accommodating their goals and patient goals. Lastly, healthcare providers needed tools that can represent patient data in different views, letting them discuss various aspects of patient data. To complete the healthcare providers' perspectives when reviewing patient-generated data, we interviewed with patients and collected a sample of their data. We interviewed 8 chronically ill patients who had already been collecting data for months or years. We obtained samples of their data collections, description of the details of their data, and explanations of their approaches to collecting, analyzing, and sharing their data. The results of our studies with patients showed how each patient was different and had a unique and individualized story. Patients use different mediums and organization formats such as notebooks, phones, online platforms that worked best for them to collect and present their health data. As a result, the patient-generated data collections became heavily personal and complex. We know that visualization has the capacity to summarize and accurately show data in a short matter of time. So to help patients better understand their data and to support communicating these patient-generated data with healthcare providers, we decided to visualize them. We started collecting design requirements from patient stories that we heard in the interviews. We saw that since every patient's story was so different, these differences made for a unique set of design requirements for each patient. Based on the list of requirements we gathered for each patient, we designed various individually tailored visualizations for that patient. Here you can see the preliminary sketches of our visualization designs, where each column represents design for one patient. Next, we wanted to look into providers' reflection on the patient-generated data visualizations that we proposed. We took the visualizations we designed and asked healthcare providers about their opinion on these visualizations. Not only patients were very individual and different, healthcare providers also had various practices and expectations when planning for patient care, and they varied in how they saw these visualizations can benefit planning care for their patients. One provider wanted visualizations to encourage patients with self-experimenting and goal setting. They believed, particularly for chronic symptom management, that there is no complete treatment, but rather it's a matter of trying and experimenting. Visualization can help patients with encouraging them to self-experiment. One provider showed interest in a holistic visualization view of all the data items a patient collects. They found the visualization designs that represent all data items in one view very useful for planning complex chronic care. On the other hand, one provider was cautious about juxtaposing all the patient data items in a single visualization view. They were concerned that juxtaposing patient data could imply a link that may not exist or falsely medicalize the relationship between the health data. So they wanted the visualizations to be inviting for patients to collaborate with providers while they're analyzing patient data. Overall, providers were able to quickly adapt to visualization designs and warmed up to the idea of alternative views of data, promising for adoption in their practice. One provider said, "Over the years, I got used to this because before that was all we had. We never had this kind of thing, visualizations, and so this is where the notion of the same data, different lens become useful." To conclude, we have added a way that can support patients and healthcare providers when reviewing patient-generated data during clinical visits by exploring the possibilities of designing individual tailored visualizations representing patient data. To summarize, we identified 4 factors shaping patient-generated data. We demonstrated a design space of various individually tailored visualizations representing patient-generated data collections, and we provided considerations for designing future patient-generated data visualizations. It's important to design patient-generated data visualizations for individuals by considering each patient and provider rather than designing with the purpose of generalization.